PDK, and this is my client Srikanth. We are going to go through the assessment today. The client's chief complaint is that he complains of back pain, and it's existing for past 1 week. The client has stated that he has lifted some weights, and he goes regularly to the gym, and so when he was lifting some weight, he has got the pain. And recently, patient says that he has pain while forward bending, and on rest there is no pain. It all settles off. There is no past history of back pain, or there is no past medication he takes. He had a natural birth, and there is no birth problems or any history of issues. And I have all done his vitals, and the BP is 125 by 90. And I've also asked the consent of the patient. We are going to assess you, and it might increase or it might aggravate the pain during assessment or during the treatment session. And whatever treatment and whatever assessment we are going to do is within the scope of manual osteopathy. That's what we're going to practice. Is that okay with you? Do you consent to go ahead with the assessment and the treatment?
Yes, I consent.
Yes. And that would be great. And we have already done the assessment with the assessment is done with regards to OA module. I have initially asked the client to do the global testing and Michel testing, and we have gone through the where is the deviation and everything. And for the current module, we are going to ask the patient to do the standing assessment for the body posture, to know how is the fascia and how it is showing with the client. Can you stand up for me? And the client is standing. I'm going to see the client in the anterior lateral view and in the posterior view. So in the anterior view, you can see the creases in on the chest area, and you can see the forward bending of the knee. When I come to the lateral, you can look up straight. There is a mild bending at the forward bending at the knee flexion is there, elbow flexion, and looking at the creases over there. And coming on to the other side also, you can see the fascia, how is it pulling it over here. And there is also a mild bending of the flexion of the knee, and there is flat foot on both the legs for him. And can you please turn around? We're going to turn the client, and you can see is how lordotic his curve is probably, and then you can see the fascia coming over there. It is constricted. And the next test we are going to do is the stroke test. In the stroke test, can you look at me? So in the stroke test, we are going to, I'm going to hold on to the pelvis. Is that okay?
Yeah.
Okay, I'm going to hold on to that. And can you bend your right leg up? Okay, stand straight, Srikanth. You don't need to, if you want, you can hold on, but you don't need to lose your balance or anything. Bend your leg up. Now level. Okay, down. Okay, bend the other leg up. In both the side, I'm going to look for the PSIS going down, but it is normal. And now can you raise the hand up all the way, just like the prayer? Okay, and then can you bend this leg up? Yeah, and down. Bend this leg up, the other leg. Okay, good. Down. Okay, bring your hands down. Looks like the patient, the client is seems to be there is left and there is inferior deviation which I am looking. Looks normal. There is no deviation taking place for the client. Now, can you lie down on this? And over there, please. Now we are going to assess the CCP for the client. With the CCP for the client, I'm going to hold on to the neck. I'm going to bend the neck, and I'm going to turn to the right side, and then I'm going to turn to the left side. Seems like the right is easier than the left, so the rest left is. And then I'm gonna look for the next one. What we are going to look is the at the shoulders. I'm gonna move over on the rotate towards both the side, and seems the left side is tighter. And the next one, what we are going to do is the rib and the pelvis. So I'm gonna keep over here. I'm gonna move the hand over here on both the sides. So the left seems to be affected, and the next one is the pelvis area. I'm gonna keep the pen over here, and I'm gonna move it, and seems like the right is affected. So the next one is what we are going to do is the breathing part. We're gonna assess for the rib cage. So I'm gonna keep over here on the rib, and then I'm gonna see whether the ribs are moving in a bucket handle movement on up and down. And the other type what I can do is I'm gonna see on the top and the bottom. So and check on both the sides. Now I'm seeing whether it moves superiorly and anteriorly, and it moves in normally. There is no problem with that. And the next one, what I'm going to do is the breathing wave, which we did what we have done. The next one would be the pelvic diaphragm and the sacral rock. In this, can you turn around, face down? Yeah, in this, I'm gonna touch your glutes. Is that okay, Srikant?
Yes, I can send.
Yeah, we're gonna place the hands over the pelvis, and then we're gonna see as he's breathing whether there is any movement inferiorly, and this seems to be normal. And then the sacral rock, we're gonna check for the counter nutation and the nutation when he is doing the inspiration and the expiration. And following that, we are also going to check for the clockwise, that is the facial assessment. In the facial assessment, the client says that he has back pain. So I'm gonna pull the shirt up. We're gonna have it over here, and he says at the lower back. So I'm gonna have the hand on one side, and I'm gonna move the hand superiorly, and I'm gonna move the hand inferiorly, and I'm gonna move it medially, which is easier, and then I'm gonna move it superiorly, then inferiorly, and I'm gonna move it laterally. I see a binding there. So during the treatment process, I would be stacking this using either direct or indirect method, where I can use it superiorly and inferiorly, and then I will move it in the ease, which is the indirect method, or I can go towards the binding side and do a rotation and then stack it there to do a direct method. The next one, what I am doing is the lumbosacral decompression. In the lumbosacral decompression, Srikant, can we have you turn around, face up? So in the lumbosacral decompression, I'm gonna leave my hand in between his legs and hold the sacrum, and the other hand will be at the lumbar, close to and L3 or L4. Srikant, can you bend your legs? And can you lift your pelvis up for me? I'm going to stick my hand underneath. Okay, rest it. Okay, let your legs go down. So I'm going to rest it. I'm going to feel for the lumbar, and then I'm going to pull down, and then I can feel it, and I can see there is some restriction at the L3 at the lumbar region. Okay, can you lift it up? And then we are going to take it out. And then what we are going to do now is the So what do my clinical conclusion for my client is the low back pain is caused due to the tight erector spinae, and there is also lumbar L3 L4 problem. Rotation is there, which could be corrected using the OE method. But with regards to the myofascial technique, I am going to address the treatment techniques with for the erector spinae, and he also has tightness at the quadriceps, where he also because of the lordosis and the anterior pelvic tilt, I will also address his quadriceps. So with regards to clinical reasoning, the patient is having an anterior pelvic tilt, and so there could be tightness in the muscles, especially the erector spinae, and the rectus and the quadriceps is also tight, where because of the muscle spasm due to nociceptors and the pain receptors activating, patient could complain of pain. That is the reason for your pain, Srikanth. Is that okay?
Yeah.
And contraindication, I have informed the client about the contraindication. Is he having any fever or any fracture or anything? Patient has said there is nothing, and there is no history of any of the contraindications for our treatment procedure. And with regards to the current evidences, there are latest literatures in PubMed and other JOST journals stating that treatment of manual osteopathy is really helpful in decreasing the spasm of the muscle when applying a constant pressure to one particular area and stacking off, adding on the pressure to the particular area of treatment. So I usually palpate the tissues. Initially, we're gonna start with the treatment of the obliques, and we're going to start with the quadriceps tightness, so especially the psoas area. So in that case, we're going to do is we're going to cross the hand over here and keep the hand on the quadriceps and on the abdomen, and then we're going to separate it, and we're going to move the hand and move it up and down. Is that okay, Srikanth?
Yes.
Okay. And we are going to stack the pressure over there and do the treatment and hold it for as long as we see the muscle is giving away and ease is taking place. And following that, we are going to treat the erector spinae. While treating the erector spinae, we are going to ask the client to sit down on a chair. Have a seat. I'm going to bring you the chair now. Can you sit down over here on this, and can you turn around? Sit down. So support your hand and over here. And when we are doing this technique, we are going to keep the hands over here, and then we're going to slowly slide the hands down over the erector spinae until he feels the ease. Okay, thanks, Srikanth. Have a seat. So this is the technique what we are going to follow for the client, and that will also give relaxation and ease the muscle spasm and tightness. And following that, we are going to re-evaluate the client by palpating the muscle. Are you okay? Is the spasm decreased? And we are going to palpate the back of the muscle also to re-evaluate, and then we see the muscle, how is the palpation and how is the condition of the muscle. Thank you.